So moving on to the next item, the 14 to 19 workstream verbal update from that group. There hasn't been a workstream group meeting for some time, but nevertheless Craig Bolt was able to report on the positive exam results that were received over the summer. He also then highlighted that there's a change in post-16 commissioning arrangements. The Secretary of State has issued a revised set of arrangements so that local authorities will still commission under the fairly new model that's just been changed, but the Young People's Funding Agency will be funding that work, and although there will be a reduced contract management arrangement between the YPLA and the ultimate providers. The Children and Young People's Plan, moving on to that next, the board agreed that the next plan, 2011 to 2014, will be much shorter and sharper in focus, and looking at where the trust can add value by working together. Some initial high-level issues have been identified, for example, cross-cutting poverty and demographic issues, particular groups that should be focused on disabled children, children of offenders and children in care, and thirdly, the outcome areas which need a joint focus. In the discussion, the points raised by the board including suggested that extra children, those that are at risk of offending, and specifically BME children and young people would be added to this high-level list of issues. And also, of course, in the current climate, the issue of reduced opportunities for employment. There is a difference between those that are young people that are unemployed but very highly motivated, and those that are in the sustained unemployed group, which do need a different approach. And we need to also reflect how young people move out of children and young people services post-19, so care leavers, disabled children and young people and offenders. In the discussion, it was also suggested that the Trust should focus on the social causes rather than just the symptoms, and that the links with housing should be stronger and more explicit. So the board would like to focus on 4 or 5 big issues where it can come together to influence and bringing together different people around the table for different issues. So next, the item was on the report from the Raising Attainment Workstream Group. And overall improvement has been seen at each key stage, and also faster improving and narrowing of the gap was reported. The board agreed it must aspire to every child attending a good, not just a satisfactory school. And we heard that Nick Gove, the Education Minister, rather than prescribing the methods, has challenged each local authority to set out how it will improve education. So this needs to be a collective view by the Trust, and the biggest risk at the moment is the primary school level and the primary school's own capacity to drive their own improvement. So, the board agreed that they would need peer-to-peer challenge, and governors will need to understand the benefits of a federation and a collaborative approach to improvement between schools. The next item, the update from the Bristol Safeguarding Children Board. That board's annual report and business plan have now been published, and their current work includes an audit of casework and case planning across agencies where there are intimidating and threatening family members. They want to have a development of an interagency performance reporting framework. A training programme is well underway. and the board's annual conference will be on the 26th of May next year. We next heard about the early intervention review, and I would point out at this moment that Alison Jackson, who is the lead person in the City Council for this, is going to provide some more detail for the written report, which will be going on the VOSCA website. This is quite a very important piece of work. It's looking at tiers 2 and 3 of the triangle of needs where interventions are put in place, and it's looking at the an area focus for that, so that neighbourhoods can link in, and there will be an options appraisal for procurement or direct delivery of some of the functions, which will be conducted in November or prior to November. Now, at the same time as this review, the Youth Links Board is doing work at the same time, looking at connections, the youth service and other commissioned services. So a lot happening, and as I say, there will be some more detail in the report that goes on the website from this meeting. And then just finally, there were some reports circulated for information on healthy schools, a national report on health services by Sir Ian Kennedy will come to the next board meeting, and also I just remind people that there is a consultation on the GP consortia options. This is where GPs are going to be commissioning a lot of health services, and so there is a consultation document. You'll see that on the VOSCA website as well, but Trust Board members are individually asked for their responses to that as well. And then finally, there is, to develop local evidence, a series of seminars has been arranged by Bristol University on evidence-informed practice, and the first one is going to be on play. So that's it for the last meeting on the 20th of September. The next meeting will be on the 22nd of November, and if anybody would like to contact me for further clarification or to raise any issues with me, please feel free to do so. Thank you.